Hello, and welcome to ADCES's podcast, The Huddle, Conversations with the Diabetes Care Team. In each episode, we speak with guests from across the diabetes care space to bring you perspectives, issues, and updates that elevate your role, inform your practice, and ignite your passion. I'm Jody Lavin-Tompkins, Director of Accreditation and Content Development at the Association of Diabetes Care and Education Specialists. My guest today is Dr. Eileen Egan, an endocrinology nurse practitioner at Tidelands Health in South Carolina. In this episode, we'll talk about meeting glycemic and weight goals early after a type 2 diabetes diagnosis and best practices for helping people stay motivated and engaged. Eileen, welcome to the Huddle.
Hi, Jody. Thank you. I'm so happy to be here today with you to discuss this really important topic for people with diabetes.
Well, great. Well, before we get into today's discussion, could you tell our audience a bit more about yourself and your work as it relates to today's topic?
Sure, I would love to. I have worked in the field of diabetes in various capacities for a little over 20 years now. Currently, I work at Tidelands Health, which is a community-based hospital system in beautiful South Carolina. As an endocrinology nurse practitioner, one of my goals has always been to provide people with diabetes the necessary education and tools as early as possible to live well with diabetes and to avoid complications. And Jody, South Carolina ranks 6th in our nation for highest prevalence of diabetes. So where I live, like so many other places across the country, there is so much opportunity for the diabetes care and education specialists to assist people with diabetes.
Absolutely. And Eileen, we know that there's an interplay between weight, glycemic management, and related complications. So I think it's important to first understand the prevalence of obesity in people with type 2 diabetes. So can you tell us a little bit about that?
Sure. First, I think it's important to start by defining obesity. The World Health Organization defines obesity as excess or abnormal fat accumulation that presents a risk to health. The American Diabetes Association expands a bit further upon that definition by adding that obesity is a chronic, relapsing disease with numerous metabolic complications, physical and psychosocial complications, in particular, type 2 diabetes. Obesity and potentially abnormal adipose pathology can result in adipose hypertrophy, visceral adiposity, and ectopic fat distribution. These things, Jody, can be associated with systemic inflammation and metabolic dysfunction and ultimately increase the risk for both microvascular and macrovascular complications. Now, as far as diagnosis of obesity, typically we do this by measuring a BMI, and greater than or equal to 30 is consistent with a diagnosis of obesity, although there are important race and ethnic considerations with BMI. So a diagnosis of obesity should also include not only BMI to assess overall mass, but also waist circumference or waist to height ratio to assess adipose distribution, as well as the assessment for the presence of associated health or well-being consequences. And within the U.S., Jody, as many as 85 to 90% of people with diabetes have overweight or obesity. But obesity and type 2 diabetes are heterogeneous, meaning not all people with obesity have type 2 diabetes, and not all people with diabetes have obesity. So an individualized approach implemented early on is key to help reduce the future risk of complications associated with these conditions.
Yes, of course, individualization. We hear a lot about that in all the guidelines and everything we read. So we know it's very important. And it seems like this is a very big issue for people with type 2 diabetes. So how does reducing obesity have the potential to reduce micro and macrovascular complications of type 2 diabetes?
That's a really important question, Jody. So excess adiposity is a key driver in the development of cardiovascular disease, chronic kidney disease, and an increase in all-cause mortality risk, and has been associated to negatively impact quality of life. On the flip side, weight loss can reduce cardiovascular risk factors like hyperlipidemia and hypertension, which contribute to the development of complications associated with excess weight in people with type 2 diabetes. So, a weight loss of 3 to 7% can improve complications related to adiposity by improving glycemia and reducing cardiovascular risk factors. And a sustained weight loss of greater than 10% confers greater benefits with disease-modifying effects and the potential for diabetes remission.
Well, Eileen, you've talked about the importance of weight loss and risk reduction. Is there a role of timing to that?
Well, the short answer is yes, definitely yes. We have some great studies to back that up. The Diabetes Remission Clinical Trial, or DIRECT, was a randomized clinical trial to assess the effect of early weight loss on type 2 diabetes remission. In the DIRECT trial, early weight loss reduction was associated with improvement in A1C, with individuals achieving weight loss at 24 months more likely to achieve diabetes remission than those who did not have early weight loss. Unfortunately, most people weren't able to maintain the weight loss at the 2-year point, so we have more work to do to learn about early weight loss and long-term benefits. Another key trial, Jody, was the Look-Ahead study. In this trial, individuals with type 2 diabetes who were randomized to intensive lifestyle modifications with a goal of achieving sustained weight loss did not have any significant difference in major adverse cardiovascular events compared to those who received diabetes support and education alone. But for participants who lost at least 10% of body weight, there was a significant reduction in these cardiovascular events.
Eileen, thank you for reviewing the evidence for weight loss early and risk reduction. Now, what about achieving A1C targets early after the diagnosis of type 2 diabetes?
Yeah, another good question. So here, too, we have great studies that support achieving A1C targets early are beneficial. Landmark trials such as DCCT, EDIC in type 1 diabetes, and the UK-PDS trial in individuals with newly diagnosed type 2 diabetes have shown that A1C of less than 7% early on is associated with enduring reductions for several important diabetes-related complications, including microvascular and macrovascular complications for at least 10 years. The Diabetes and Aging study, Jody, was a more recent large observational study in which A1C levels of greater than 6.5% within the first year of diagnosis of type 2 diabetes were associated with increased microvascular and macrovascular events as compared to A1C levels less than 6.5% over the same time period. So we have learned that achieving A1C targets early on translates into reduced risk for complications down the road. This is referred to as metabolic memory or legacy effect. This perspective on meeting A1C targets early, having the potential long-term benefits, is analogous to investing in a savings account, where an investment is made in the present and can have long-term benefits that can be accrued in the future. Actually, Jody, as an add-on to this podcast, there's a tip sheet that you can find in the show notes that the listeners can use with their patients to illustrate this analogy. So, when we consider these data and current guidelines, the key role in addressing and achieving glycemic and weight management targets early on is really important to consider.
Well, I'm glad to hear there is a tool that our listeners can use with the people they see. That's always really helpful. So thank you for that. And so, Eileen, when you're creating these treatment plans early after the type 2 diagnosis, then how do you incorporate weight management?
So I think it's important to make the connection for the person. And what I mean by this is that I offer education about excess weight. People do not always make the link between overweight and obesity and health risks that these conditions are associated with, such as increased morbidity and mortality. I provide education regarding the potential for weight loss to reverse underlying abnormalities of type 2 diabetes and reverse or slow down disease progression, highlighting that weight loss is the most significant predictor of type 2 diabetes remission. Also, I emphasize the importance of intensifying efforts early on to achieve individualized goals and reduce the risk of complications later on. And then, of course, we need to discuss lifestyle modifications that are evidence-based. So we incorporate discussion regarding nutrition changes, physical activity, behavioral health counseling, as the literature supports that each of these factors is important in diabetes management. So with the patient at the center, we set small goals using shared decision-making to drive these goals.
Yes, I agree, Eileen, that lifestyle modifications are always critical and are very helpful. So I'm wondering if you have an example from your practice of someone that you worked with that might bring this to life that you could share with our audience.
I met a gentleman who had been diagnosed with diabetes 6 months earlier, type 2 diabetes. He also had obesity. He was already on 2 oral medications and his A1C was 8%. He was not making progress in losing weight despite trying to improve his eating pattern and increase his physical activity. He felt really defeated and scared. He had not received any diabetes education. So we talked a lot about the impact of obesity on his diabetes and overall health. And I shared with him how weight loss and lowering his A1C early in his diagnosis of diabetes had the potential to significantly reduce his risk for several important complications, such as microvascular and macrovascular disease, as he aged. He felt really hopeful, and he was willing to make changes in his meal plan and begin a walking program. At the next visit, he had lost 10 pounds, but was feeling that his weight loss had stalled. He wanted to attend his niece's wedding in 4 months, but could not quite fit into his only suit. So there was his personal motivation. We spoke about the different treatment options available to him and came up with a plan based on shared decision-making, which included an individualized nutrition and activity plan and using a medication for his blood glucose that would also help with his weight loss. He was able to lose additional weight, lower his A1C to 6.3%, and fit into his suit. So he was feeling good. So in summary, early intervention in this situation will certainly help this gentleman reduce his risk of complications moving forward.
Oh, thank you for sharing that story. That's always nice to hear, especially with positive outcomes. So, what do you think the best way is to help people stay motivated until they reach their goal?
Well, getting to know the patient and making the connection, I think, is the key. And the diabetes care and education specialist is so skilled at doing this. We want to learn what's most important to the person with diabetes. Ask what's driving them, what makes them want to improve their health. Educate on the importance of weight and glycemic management early on, which can ultimately improve their diabetes and reduce their risk for complications. So in summary, Jody, diabetes care and education specialists and other members of the healthcare team are in a great position to help people if we can make that personal connection and we can stress the importance of doing the work now, early on, to impact their trajectory with diabetes in the long term. I find it gives them a lot of hope and helps to keep them motivated.
Well, Eileen, thank you so much for joining us for this episode of The Huddle. This topic is really important, and we appreciate you sharing your insights with us.
My pleasure.
Thank you for listening to this week's episode of The Huddle. I also want to thank Lilly for partnering on this episode. Make sure to download the resources discussed in today's episode. You can find them linked in the show notes at adces.org/podcast. And remember, ADCES membership gets you free access to resources, education, and networking that improve your practice and optimize your outcomes for your clients. Learn more about what ADCES can do for you at adces.org/join. The information in this podcast is for informational purposes only and may not be appropriate or applicable to your individual circumstances. This podcast does not provide medical or professional advice and is not a substitute for consultation with a healthcare professional. Please consult your healthcare professional for any medical questions.